First of all, the CDC has recommended people wear a mask when social distancing measures are difficult to maintain, but a mask can be less effective if it's not worn properly. So I'm going to talk about some do's and don'ts. One of the first thing is to wash your hands before putting on your mask. Your face mask will come in close contact with your mouth and nose before putting it on, so make sure that your hands are clean. Also, do make sure the mask fits snugly, covers the mouth, nose, and chin. Make sure the mask fits snugly and covers the mouth, nose, and chin. Wearing a mask will help prevent you from spreading respiratory droplets into the air. CDC update their recommendation for mask usage because studies found people with coronavirus can transmit the disease to others before showing symptoms, even if they are not showing symptoms at all. Another do is use the ear loop to remove your mask. If you're wearing the mask that have the ear loops on it, make sure you use it to remove the mask. If you have a cloth mask, CDC asks that you wash your mask daily. After each use, wash your mask daily. Let's talk about some don'ts. And these are the major don'ts that I'm quite sure that many of you have seen, that I have seen out while in the grocery store. One is wear your mask only on the tip of your nose. You have seen people wearing it only on the tip of their nose or leave their nose exposed up under there. Do not do that. Don't leave your chin exposed. As I said earlier, it should cover the nose, mouth, and chin, and it should fit snugly. Don't leave gaps on the side of the mask. Don't touch the mask on your face while you're using it. Try to prevent from touching it. Don't pull the mask down up under your chin. Of course, you've seen that, people wearing it around all up under their chin, up on the bottom. Another don't is do not wear it at the top of your forehead while inside of public places. Don't reuse single-use masks. Single-use masks, such as ones that's made from paper towel, should not be used more than once. Dispose of the mask after one use and use a new sterile mask the next time that you need it. Don't have a false security. It's the last thing I want to leave you with. Wearing a mask make you feel more protected than you actually are. It's important to remember wearing a mask won't automatically mean you will not catch the virus. The most effective way to protect yourself from COVID-19 is still staying at home, washing your hand, and practicing effective social distancing. Thank you.
Thank you, Jennifer. I'm going to add a few comments to that. I think everyone saw how I put my mask off and on. You also generally want to hang your mask up, or if you have a paper bag, you can place it in a paper bag. For individuals who don't have masks, we actually had David here to demonstrate. If you want to stand back up, David, thank you. David chooses to wear a cotton wrap. Sometimes I'll wear a cotton scarf. So this is always an option, but you want to make sure that you have a natural fiber, preferably cotton, but you could also use silk, and you want it to have several layers. By using a wrap, you actually save some of the surgical masks for others. So David, I appreciate you being here. And then I also want to demonstrate the masks that have come from the governor's office, because they're a little bit different in that they don't have the ear loops. So you would cover your nose and your chin, and then you would tie at the top of your head. And then you would tie at the back of your neck. And as you take it off, you would take it off by the strings, not handling the part that is near your face or your mouth. As I've been out, I've continued to see many people wearing face masks and covering, so I really want to acknowledge and appreciate each of you for doing that, for protecting yourself as well as others, and particularly protecting our family members and those who are seniors in our community. I've asked Ms. Alexander to join us. She's going to talk about restaurants, and then we'll open it up to questions as we always do.
Good afternoon. Just to let you know, restaurants at this phase should be at 50% capacity, and tables should be spaced where they are at least 6 feet apart from each customer. Also, all self-service stations and buffets are prohibited during this time. So no refills on drinks or filling your own containers. That must be done by staff. All menus at this time also should be disposable. All employees, servers, hostesses, and also people in the back of the house in restaurants should have on masks that cover their nose and their mouth. Any pickup or to-go orders, curbside service should also be done where it is not impacting the 50% capacity on the inside of the establishment, and also making sure that gatherings are not happening on the outside while people are waiting for their food. We are asking and suggesting that restaurants allow people to return to their cars and either have a pager or a text message, let them know when their food will be readily available. If there are any concerns during this weekend or going forward, we ask you to continue to contact the COVID-19 line to lodge any complaints or any questions that you might have at this time. We also will be working with the Memphis Restaurant Association to make sure we get the information out properly to everyone. Thanks.
And we will open it up for questions.
Jackie Massey with Fox 13.
Hello, how are y'all doing? My first question is about an ordinance that was proposed that would require people to wear masks in public in Memphis and Shelby County area. If that is passed, how do y'all expect that to, how do you think the public will perceive that? We've been hearing a lot of news stories in other states about people claiming that their civil liberties are taken away by having a law that enforces them to wear a mask, and just a lot of protests and unrest by having the government step in and say, you must wear a mask. If that is the case in Memphis, how do you plan on handling that if there's a bunch of backlash? And my second question is about asymptomatic COVID-19 positive people who test positive, who have asymptomatic symptoms. Do you have a percentage that are asymptomatic versus symptomatic? Like, do you know how many people who tested positive are asymptomatic?
So let's start with your first question. I do understand that an ordinance was proposed to the city council. I also know that within the county commission, at least one commissioner is considering proposing something similar at the county level. I would say that I will leave that final decision up to the elected officials, and those elected officials clearly will consult with attorneys on what we can legally and not legally do relative to ordinances. But I think your bigger question has to do with how will people respond to that. And I think across the country we're seeing mixed responses. Some people are very vehemently opposed to government telling them what to do. Others understand that this is a pandemic and that actions are necessary to reduce transmission. I would go back to what we've been saying all along. We have significant compliance in our community, so we want to encourage people to take appropriate action, and that way the ordinance just supports what we're already doing. Your second question had to do with percentage of people who were tested that were asymptomatic. We are still gathering that information. That's not been typical reporting. At some of the events or surge events or places where we've done cluster testing, we have a better percentage within those particular test events, how many were symptomatic and positive, how many were asymptomatic and positive. But the Joint Task Force has asked that the testing sites start to provide that information to us, so our hopes are that within a week or so we'll be able to report that data more collectively for the entire county.
Kendall Downing with WMC TV5.
Hey everyone, good afternoon. Two quick questions. One is about the mask that the governor's office sent out. We've gotten some criticism and seen some criticism of those state masks, that the fabric has some holes in it and is not particularly thick enough in what the CDC recommends. What do you all think about that? And then my other question is about the Highlands Nursing Home with 58 confirmed cases among residents and staff members. What is being done with respect to that outbreak? We are hearing a lot of concerns from loved ones who have loved ones in that facility. And is the state more involved with that outbreak? How are you working that?
Because let's talk about the mask specifically. I actually brought one of those masks with me so that I could demonstrate with that mask. It actually is fairly thick cotton, so that it is more than one, I would say, ply depth. It's not like there's layers of the material, but it is thick enough to be able to serve as a mask. The ones that we've looked at do not have any holes in them, but they are like a knit product, like cotton is knitted on a loom. And so with any product, I would assume there's opportunity for some, I'll say, blemishes in the fabric, but the ones that we've looked at have not been problematic. They do actually have a little bit of a stretch to them. I'm actually going to get one so I can show it again. I apologize. They are cotton, but they have a little bit of a stretch, which actually makes them fit your face much more tightly than a lot of the cotton masks that you see individuals wearing. So from my perspective, I don't have any complaints about the mask. Others may feel differently, but from our end, they meet what would be CDC expectations for a facial covering, particularly one that's made of cotton. As far as the nursing home facility, actually we had a conversation about that facility yesterday. It was my understanding that our health officer was going to reach out to the Tennessee Department of Health to receive some additional technical assistance around that facility. Beyond that, I don't have any specific updates, but if I do later in the day, I can ask Joan to get that information to you.
Laura Testino with the Commercial Appeal.
Hey, I wanted to ask about childhood cases today. So 3 weeks ago, Shelby County was running pretty similarly to nationwide stats, with those pediatric cases under 18 being about 2%. As of today, it's reported that they're closer to 6%. Why is this the case, and what do we still need to know about cases in this age group before reopening schools and/or colleges?
So I'll start with the one comment. Is usually on Friday we give very detailed updates on our deaths as well as pediatrics. So we'll give more detail tomorrow, and David will provide that particular update. Do keep in mind that we have increased testing significantly over the past several weeks, and so it can be a reflection of increased testing, in particular targeted testing in key communities. So I would not draw any early conclusions at the moment. And then also as we move back towards school, that's many months away, and so we'll be continuing to look at the data as we move closer to school reopening and make recommendations to leadership, including the elected officials as well as the school officials in various municipalities, on the decisions that they need to make to prevent spread in their particular schools.
Bradley Broders with Local Memphis 24.
Hi everyone. Everyone. Good afternoon. Dr. Haushalter, since yesterday, is there any update on the changing calendar on the surge? Additional information with that, and I'll wait for a second question.
Well, actually, I'm going to have to ask you to repeat it because you were breaking up. I apologize.
Sorry about that, Dr. Haushalter. I was just wondering, since yesterday, if there was any update on the changing surge timeline, if there was any more specifics on that.
No more specifics on that. We're monitoring data regularly, and the key message yesterday is the same today, is that we will impact that surge by adhering to social distancing locally. And so as much as we can continue to reduce transmission, we will push that surge off further in the future and ideally have less of a surge, so that even though we'll have increased demand for hospital beds, ideally it won't exceed our capacity. And then your second question, please.
Yes, thanks, Dr. Haushalter. Yesterday, you might have seen that Governor Lee allowed in those 89 of the 95 counties, obviously not Shelby, but allowing bowling alleys and arcades to open Friday. Since yesterday, has there been any discussion? I know there was the compromise with the hair salons, but since bowling alleys aren't opening until phase 3 of the plan, is there any concern we could be maybe doing any more adjustments or compromising with that?
So there aren't any changes as of between yesterday and today, but do keep in mind we have a reopening subcommittee, and there's a good representation from different perspectives. So I serve on that committee, as well as Dr. McCullers, who's joined us previously. We have legal representation, and then representation from executive level of the city and the county, and we're going to meet weekly and revisit the plan. One, based on the data that we have locally on our cases, but also our public health capacity, testing capacity, and healthcare capacity. And we will also keep apprised of the decisions the governor is making, and the document will be revised based on the committee working together to come to consensus. So no changes, but it doesn't mean that there wouldn't be changes in the future as we review the plan.
Bill Dries with the Daily Memphian.
Yes, I have just one question, and it involves a quote. The mayor of South Haven, right across the state line, wrote something on his blog a couple of days ago, and I want to just read a brief excerpt from it and get your thoughts on it. He writes, "With all due respect, we are blessed with some of the most talented physicians and scientists in the world, and we would not have achieved the success we have in this fight without them. But it is time to return them to their proper roles as advisors and let our elected officials make policy decisions." Your thoughts on that?
Well, I'm not going to make specific comments on his comment. As an elected official, he has the prerogative to share his perspective. What I would say is that the role of the health department is fundamentally different than some of the advisor roles. And that's a role that's identified in statute. And so while we have the ability to provide advice, just like some of the physician colleagues that have joined us, as well as our academic colleagues who provide assistance and insight as well, their role really is advisory. Our role is multifold. One is to provide advice and recommendations to the elected officials, but we also have a policy-making authority through our ability to do health directives. We do that as part of historic public health role, and so we can continue and will continue to do that. But again, our role is significantly different than our physician or other healthcare leaders' role.
April Thompson with WREG.
Historic public health role, and so we can continue and will continue to do that. But again, our role is significantly different than our physician or other healthcare.
Oh, April, having some technical difficulties. We'll come back. Next question, Jacob Steimer of the Memphis Business Journal.
Yeah, I was wondering if Director Haushalter or Ms. Randall could discuss what we've seen restaurants do incorrectly so far, if these kind of recommendations are just kind of reminding people, or if there are specific things that some restaurants have struggled to comply with in the last few days.
So I'll ask Ms. Alexandra to come up, and she can answer that question, but I think this is a good time for her also to reinforce what the role of the health department is in inspecting restaurants and how we'll use our existing staff to provide education and support as well as enforcement.
So to address that question, the biggest thing that we have seen that restaurants are working with is also maintaining the social distance with their staff. Prior to the new changes that have been in effect, the biggest thing for them was maintaining the 10 or less staff in their establishment. Now we're saying the 50%. Their staff are included in that number as well. So for some businesses, that's going to be a significant impact against them as far as making sure that they do have enough staff to ensure a safe product, and also making sure that they can make some money out of this as well. The other thing to address that Director Haushalter mentioned was that we are inspecting these establishments while we are there, and we are providing education. This is a learning curve for everyone involved, and to make sure that everything is done safely for the consumer and that everyone is protected during this time.
Jacob, did you have a follow-up?
Just if you have a number or a rough number for the amount of ones you've had to visit and kind of remind of the regulations.
Okay, no, I don't have a number at this point in time as to how many that we have visited. Some of them have been very minor, as far as maybe too many people were waiting for to-go orders, or they weren't enforcing the social distancing. So those were the kind of things, but I don't have a number for that. As far as the ordinance is concerned and our enforcement authority, we will be doing regular temperature checks, making sure that food is kept hot that needs to be hot, making sure refrigeration is adequate in these facilities. Some of these restaurants have been closed for a time being, so we're making sure also that they are returning to sanitizing, cleaning, disinfecting, anything that they need to. So we will be looking at to all of that to make sure that they are adhering to those guidelines as well.
Wendy Thomas with MLK 50.
Yes, I wanted to ask a question about worksite visits that you're making, particularly as it relates to warehouses. How are you ensuring that warehouses are following the health directive as it regards to social distancing? If you're not making sites, are you relying on workers to alert you to possible problems?
Yes, we are relying on the employees to let us know if social distancing isn't being done, if they are not allowed to wear PPE. And in some instances, we have gone out to these sites, and in other instances, we have contacted the employer to see exactly what's going on, what are their best practices that they are observing at this time.
Wendy, did you have a follow-up?
No, that's good. Thank you.
Thank you. Kwamitra Wilborn with WREG.
Good afternoon, everyone. So my question, this is a big week for restaurants reopening. You had Cinco de Mayo and now you have Mother's Day this weekend. My question is, we saw large crowds the other day, and you're probably expecting those same crowds to come out this weekend. How do you think that will impact the numbers moving forward? And also, how do you think that will affect the surge that we know has been pushed back? But do you think that opening up this week will negatively impact those numbers?
I'll turn it over to the director.
We're not expecting that by opening we're going to cause the surge. That's one of the reasons that we've continued our messaging around safer at home, stay at home, the importance of social distancing, and particularly the importance of wearing facial coverings while out in public, continuing to exercise what we call cough etiquette or good cough and sneeze hygiene by covering one's face, and also good hand washing. We believe by implementing those measures and all of us collectively doing that and individually doing that, we will continue to reduce the spread in our community. The other message that we've reinforced is the importance of protecting our most vulnerable populations. So an example may be this weekend, if there's a senior in the family, the decision may be not to eat at the restaurant, but to get the order to go so that that senior can be protected from exposure to others.
Omer Youssef with the Daily Memphian.
Good afternoon. I have two questions. My first one is on today's data. So when you're looking at whether we're trending downward or stabilizing, how do you look at a day where cases did spike up, but testing also went up significantly and the positivity rate went down? And I have a second question.
So we really are looking at trends over time. One day by itself isn't sufficient to make a decision. We look at the total number of cases day to day over a period of time. We also look at the date of reporting as well as the date that the actual specimen was collected. And sometimes when we have a jump in reported cases, it may be that the lab submitted a bunch of reports in one given day. We also look at positivity rate, which you noted has decreased. And so we look at that, but they're relative to each other, and no individual particular measure is the driver of decision making. And your second question, please?
So my second question is on testing. You recently said that you hope to expand to about 2,400 a day. How do you go about trying to get people who may not know that they can get tested or may be scared to get tested? How do you go about getting them out to get tested for the coronavirus?
So there are many, many partners related to the Joint Task Force, but particularly with testing. As I've noted before, we have big healthcare systems that are doing testing. We also have Kroger doing testing, Walgreens doing testing, all of the safety net providers. And the safety net providers particularly meet on a regular basis to look at strategies for improving communication. And then the health department does communication. The city of Memphis is doing extensive communication, and we rely heavily on the media to help us get the messages out as well, and we rely on our partners to get the message out. There's continued opportunity to get those messages out, but we're doing everything I think we can within our power to say, one, we're expanding testing, where the testing sites are, and who's eligible to get testing. And one key area that people can go to is the website. So the City of Memphis Corona website has all of the listings there. If you come to the health department site, we're going to link you over to the city site.
We have no further questions at this time. Any closing statements from any panelist?
I just want to remind everyone to wear facial coverings while in public. It will protect others, particularly our most vulnerable populations. And thank you again for being here.
Thank you very much, everyone. This concludes our daily briefing. Please stay healthy, and we will see you tomorrow.